All right, so you're thinking about becoming a pharmacist in Ireland?
But
Your qualifications are from outside the EU?
yeah,
Could be a bit of a tricky road to navigate,
it can be pretty tricky.
especially when you're faced with a document like the Third Country Qualification Recognition Process Information Guide.
Oh, tell me about it.
It's dense, right?
It's a lot to get through.
But that's why we're here.
Absolutely.
We're going to break it down.
We're going to extract all those key insights for you so you know what you need to know
Exactly.
to make this process as smooth as possible for you.
Yeah. So think of this process as smooth as possible for you.
Yeah. So think of this deep dive as your cheat sheet
Your guide.
to understanding how the Irish system works,
Yeah.
what they're looking for,
What they're looking for.
and how to present your qualifications
Yeah.
in a way that meets those EU regulations.
Exactly.
So we're going to break it down step by step so you know exactly what to
We'll
expect.
take you through the whole journey. Yeah. But before we jump in, let's talk about the Pharmaceutical Society of Ireland.
The PSI.
The PSI.
Yeah.
What is their role in all of this?
So they are essentially the guardians of pharmacy standards in Ireland.
Okay.
They are the ones who are responsible for making sure that anyone practicing pharmacy here meets the criteria.
Oh.
It's not just about checking if you got a degree.
Right.
They dive deep.
Okay.
They're looking at the regulatory framework of your home country as well,
Interesting.
making sure that the training that you have aligns with Irish standards.
So it's not just about my qualifications,
Yeah.
but the system that trained me?
Exactly.
Okay, so they're looking at it from that perspective of, well, if your whole system is good and matches up.
Yeah, they're trying to standardize it.
Yeah.
Yeah.
That makes sense.
Consistency is key,
Especially in healthcare.
especially in healthcare.
Okay, so the journey to becoming a pharmacist in Ireland with non-EU qualifications
Yes,
is a two-step process.
it is a two-step process.
Qualification recognition and registration.
That's it.
So first they assess your qualifications,
Yep.
and then if those are good,
If you get the green light.
you can apply to officially join the register.
You can join the gang.
Okay,
Officially.
but let's not get ahead of ourselves.
No.
Let's rewind to the very beginning.
Back to the start.
What is the first thing you need to do
Absolutely.
if you're considering this path?
So before you even think about filling out that application form,
Yeah.
you have to make sure you meet the two key eligibility criteria.
Okay.
The first one is you need a pharmacy qualification from outside the EU that allows you to practice in the country where you received it.
Gotcha.
Okay, so it has to be a recognized pharmacy qualification.
Okay.
The second one is you must be eligible to practice pharmacy in that country.
Hmm.
Now, you might not be actively working there now,
Right.
but you might not be actively working there now.
Right.
But you need to be allowed to if you wanted to.
Okay. So I could have taken a career break,
You could have.
or I could be working in a different field. But as long as I'm still in good standing
Yeah.
with my home country's regulatory body,
Regulatory body.
I am good.
Then you are good to go.
Right.
You need to tick both those boxes before you move on.
So those are really important.
Absolutely. They're essential.
Okay. So I double checked
Okay.
and I meet the eligibility criteria.
Fantastic. Now
How much
what?
do I apply?
How do I apply? Well, the Third Country Qualification Recognition Process Information Guide
That's a mouthful.
that we mentioned earlier
Yeah.
is your best friend.
Right.
It outlines everything in detail,
Okay.
but we'll give you the SparkNotes version here.
Okay. Perfect.
So you need to download the required forms from the PSI website,
Mm-hmm.
the application form, the identity certificate, and a statutory declaration.
Okay.
Don't rush through those.
Okay.
Accurate and complete information is really, really important.
Makes sense.
So take your time.
Yeah. I'm guessing there are also quite a few documents that I need to gather as well.
Yeah, you're going to need your qualification certificate,
Okay.
academic transcripts, and a syllabus
Okay.
from your pharmacy program.
Right.
You'll also need documentation that proves you've done the required internship or practical training.
Mm-hmm.
It's really helpful to have these documents ready to go. And if you can get them sent directly to the PSI
From the issuing institution.
from the issuing institutions,
Yeah.
that can really streamline the process.
Okay. So it's almost like building a case file
Yeah,
for myself.
to demonstrate your competence and
Yeah.
your experience.
And my experience.
Yeah.
So it's not just about having the paperwork,
No,
but it's about making sure it's authentic
it has to be verifiable.
and verifiable.
They want to make sure it's the real deal.
Yeah. Okay. What about the application fee?
Yes.
Is there anything specific about that?
You need to pay the application fee
Mm-hmm.
and make sure your name is on it
Okay.
so that they know it's from you.
So they can track it.
And then you scan all your documents.
Right.
And you email everything
All
to
right.
non-new at tcheckiuscieie.
Got it.
And don't forget, TCQR application in the subject line.
So they know what they're looking at.
Exactly.
Okay, so I've gathered all my documents,
You've got it all together.
triple-checked all the forms,
You've triple-checked,
paid the fee,
paid the fee.
hit send on that email.
Boom.
Now what?
What happens next?
Do I just sit back and wait?
Now the fun begins.
Right.
This is where the obstacle course
Okay.
that we mentioned earlier
Yeah.
comes into play.
Uh-huh.
So the qualification recognition process has 4 distinct stages,
Okay.
each with its own set of hurdles
Right.
and potential outcomes.
All right. I'm ready.
Are you ready?
I'm ready for those stages.
Let's do it.
What's stage 1?
Stage 1.
Bring it on.
Okay. Stage 1 is all about dotting those I's,
Okay.
crossing the T's,
Mm-hmm.
making sure you've got everything in order.
Okay.
So the PSI, they do an internal review. They're checking that your application is complete
Right.
and that you meet those 2 eligibility criteria that we talked about.
So it's like a screening process
It is a screening process
to make sure
to
to
weed out the ineligible.
be ineligible
Yeah.
before it moves on.
Absolutely.
Okay.
So they want to make sure everything's in order
Okay.
before they move on to the next level of scrutiny.
All right. So there are 3 possible outcomes
They're all
at this stage.
at this stage.
If everything is complete
Yeah.
and I meet those criteria,
If you tick all the boxes,
my file's marked complete
it is
and it moves on to the next stage.
straight on to the next stage.
But if they find some things missing,
Yeah,
they'll notify me
they will.
and I'll have 6 months to provide
6 months
to get everything in.
and everything in order.
Okay.
So you've got a little bit of breathing room.
Okay, so it's not like an instant rejection
No.
if something's missing.
No, they're very understanding.
They've got time to fix it.
You do?
What if I messed up the eligibility criteria?
Oh.
Completely. Like I just didn't meet them.
If you didn't meet them,
Yeah?
your file is deemed invalid.
Okay.
And that's the end of the road
All right.
for that application.
So very important to check those.
Absolutely. Before you even
Understand.
start,
At the very beginning. Okay.
you have to make sure you are eligible.
It sounds like attention to detail is key
Absolutely.
from the very beginning.
Every step of the way.
All right, so let's say I've aced stage 1.
Okay, you've passed.
Everything's in order,
It's all good.
and I'm eligible.
You're in.
What happens in stage 2?
Stage 2.
This is where it gets a bit more serious.
This is the holistic assessment stage.
Okay.
And this is where independent experts
Right.
take a deep dive
Okay.
into your qualifications,
Mm-hmm.
your experience,
Mm-hmm.
and the regulatory framework of your home country.
Wow. They're
Well,
really
you're looking at everything.
they're really looking into it.
They are.
Why is it so important?
Well, they want to make sure that the standards of pharmacy practice in Ireland are upheld.
Okay.
Regardless of where somebody did their training,
Makes sense.
they're looking at the bigger picture.
Yeah.
Not just your knowledge
Right.
and your skills,
Mm-hmm.
but the context
Yeah.
in which you trained
Right.
and the level of rigor
Yeah.
of your home country's system.
I can see how that would be important
Yeah.
just for consistency.
It's all about consistency
Okay.
across the board.
Yeah.
Yeah.
So what are the potential outcomes
Right.
of this holistic assessment?
So this is where we come to a fork in the road.
All right.
So if your qualifications are deemed equivalent
right.
to Irish standards,
Okay.
you get a fast pass.
Oh,
You skip the exams
excellent.
and go straight to certification.
That sounds like the ideal path.
That is path A,
The easy route,
the scenic route.
the scenic route.
Yeah.
But I'm guessing it's not always that straightforward.
It's not always that straightforward.
So what's the other option?
So if the assessment reveals
Mhm.
some gaps
Okay.
between your qualification
Right.
and the Irish standards,
Uh-huh.
then you go to path B,
Okay.
which means you have to do an aptitude test
Right.
to bridge those gaps.
Okay, so path A is the express lane.
It is.
And path B is where
It's a little bit more challenging.
it's a little bit more challenging. So
Yeah.
you've got your choose your own adventure
It is
for
for-
pharmacists.
For pharmacists.
Okay. So let's talk about path B.
Okay, let's talk about the exam.
The exam.
Yeah.
What does that aptitude test involve?
So it is designed
Yeah.
to evaluate your knowledge
Mm-hmm.
and skills
Okay.
in relation to Irish pharmacy practice.
Right?
It has 2 main components,
Okay.
a multiple choice exam
Hmm.
and a practical assessment
Okay.
called an OSCE.
Ha ha ha. An OCE.
Hey, what is an OSCE?
So OSCE stands for
Okay.
Objective Structured Clinical Examination.
It's a way to assess your practical skills.
Oh, okay.
and your decision-making abilities
Yeah.
in a simulated pharmacy setting.
Okay, so it's like a role play.
It's kind of like role play.
Yeah.
Yeah.
Where you...
So you'll be presented with different scenarios,
Mm-hmm.
and you'll be asked to demonstrate
Right.
how you would handle them.
So it's less about just like
Yeah.
book smarts.
It's not about memorizing facts.
Yeah, and more
It's about applying your knowledge.
apply it.
Yeah.
Yeah.
In real-world situations,
Okay.
they want to see that you can think critically,
Mm-hmm.
that you can solve problems,
Okay.
and that you can communicate effectively.
That makes sense.
All essential skills
Yeah.
for a pharmacist.
Yeah.
Yeah.
Okay, so what kind of topics could I expect to see on the multiple choice?
So the exam content aligns with the Irish pharmacy curriculum.
Okay.
So you'll need to be familiar with things like pharmacology,
Mm-hmm.
pharmacy practice,
Mm-hmm.
properties of medicines, and of course, calculations.
And of course, always the calculations.
Essential.
So it's really to make sure that, I'm guessing the test is designed to make sure that you're at the same level
As someone who qualified
as someone who qualified in Ireland.
in Ireland.
Yeah. Okay, so let's say I've either aced the holistic assessment
Okay.
and skipped the exams,
You took the scenic route, or
done the exam
yeah,
tasks.
you've conquered the beast.
What happens next?
Next is the certificate of qualification.
Okay,
You get your certificate.
Got it.
That's the golden ticket.
that's it.
That means that the PSI
Mm-hmm.
recognizes your qualifications
Right.
as suitable for practicing pharmacy
In Ireland.
in Ireland.
So whether I took the
Whether you took the scenic route
scenic route
or the more
long row,
the challenging path.
this is the end goal.
This is it. This is the goal.
I can imagine that's quite a good feeling
It is a great feeling
to finally get that.
to have that certificate in your hand.
Yeah.
Yeah.
What happens after that?
So then you can apply for registration
Right.
with the PSI.
So this is the bit where you officially become a
You
pharmacist.
will be registered.
Okay.
You're ready to go.
All right. But let's rewind a bit.
Okay.
Let's talk about those documents.
Yes, those documents that I
Like,
mentioned earlier.
Essential documents.
I-
There are a few.
I can imagine it can feel a bit overwhelming.
Yeah, it can be a bit daunting.
Trying to keep track of everything.
Absolutely.
So let's break it down.
Yeah.
Let's focus on the must-haves,
Okay.
the ones that people often trip up on.
Okay. Document decoder.
Let's do it.
I'm all ears.
Okay, so one of the most important ones
Mhm.
is the Certificate of Professional Status.
Okay.
Now, this document
Yeah.
is essentially a verification
Mm-hmm.
from your home country's regulatory body
Right.
confirming that you're a pharmacist in good standing.
So they're basically vouching for me.
They're vouching for you. They're saying, yep,
Yeah.
this person is a pharmacist.
They can practice.
They're allowed to practice.
They're in good standing.
They're in good standing.
Yeah.
No disciplinary actions,
Right.
nothing like that.
Okay.
But here's the catch.
What's the catch?
This certificate has a limited validity period, typically only 3 months
From when?
from the date of issue.
Okay.
So you need to request it
Okay.
at the right time.
So that it's still valid.
So it's still valid.
When my application's assessed,
Exactly.
timing is important.
Timing is a key.
What other documents
Oh.
should I be prioritizing?
Another important one is the regulatory data form.
Okay.
Now, this is also known as the TCQR4.
Right.
This is where your home country's pharmacy authority
Right.
gives information about their regulatory system.
Okay.
So they're outlining their laws,
Right.
regulations, standards of practice.
So they're painting a picture.
They're giving a snapshot
Yeah.
of the regulatory landscape
Of my home country.
of your home country.
Yeah.
Exactly.
Okay.
And this form is important because it's used in that holistic assessment.
Right.
So the PSI can evaluate
Uh-huh.
the rigor and
Yeah.
quality
That was my country.
of your home country's system.
And how that matches up.
Exactly.
Yes.
They're looking for reassurance
Yeah.
that the system that trained you
Right.
aligns with their standards
Okay.
for patient safety, ethical practice.
It's all about making sure that
So you get
everybody's
all the consistency.
yeah,
Yeah.
on the same level.
Absolutely.
Okay, what about my qualification documents?
Okay.
What are the key ones there?
So you'll need your degree certificate,
Yep.
academic transcript,
Yep.
and a syllabus
Okay.
from your pharmacy program.
Right.
Again, get these sent directly
Correct.
from your
Love it.
university
Okay.
to the PSI.
What about proof of practical training?
Yes, you will need to provide
Yeah.
documentation
Mm-hmm.
of your internship
Right.
or any other training you had to do
Okay.
to practice in your home country.
And again,
And again,
send it straight from
from the source.
the source.
Yeah.
Okay. It sounds like having all these documents
It is really important
is super important to make this whole process
to make it run smoothly.
go smoothly.
Yeah.
Um, but what happens if something goes wrong? What if the PSI rejects my application?
Okay.
Or,
Or what if you disagree
yeah, or I disagree.
with their assessment?
Yeah.
Don't panic.
Okay.
There is an appeals process.
Okay.
So if you believe that their decision was unfair
Mm-hmm.
or based on inaccurate information,
Okay.
you can challenge it.
Okay.
All the details of how to do that are on their website.
On the PSI website.
Yeah.
Okay, that's good to know.
Yeah.
Obviously, you'd want to avoid that.
It's better to get it right the first time?
Get it right the first time.
Yeah.
One last question.
Yeah. Okay.
What about the English language requirements?
Yes.
Do I need to prove that now?
That is a good question.
Yeah.
So good news,
Yeah.
English language competence
Mm-hmm.
is checked during the registration stage,
Right.
not the qualification recognition.
So it's something I'll need to do eventually,
Eventually.
but not right now.
Not right now.
Okay, so I can focus on getting my qualifications recognized.
Exactly.
Where can I find out more about those language requirements?
All the details are on the PSI website.
Okay, so the PSI website is the place to go.
Is the Bible
It's the Bible.
for this process.
Okay.
Yeah.
Well, we've covered a lot of ground today,
We have.
from the eligibility checks
Uh-huh.
all the way through to those 4 stages
The 4 stages.
of recognition,
Yes.
and even looked at the essential documents
All those documents.
and the appeals process.
We've covered it all.
It's been a real journey.
It.
But hopefully now you've got a better understanding of
Yeah.
what it takes
What's involved?
to become a pharmacist
Yeah.
in Ireland with non-EU qualifications.
It's a challenging path,
Yeah,
but it is achievable.
but achievable.
Absolutely.
So the PSI website
Yeah.
is your
Go-to resource.
ultimate resource
Yeah.
for this journey.
Absolutely.
And now, before we wrap up,
Yes.
we want to leave you with something to think about.
A thought-provoking question.
A thought-provoking question.
To ponder
As you embark on this path.
on this exciting journey.
Okay. What unique skills or experiences from your home country could you bring to pharmacy practice in Ireland?
Ooh, that's a good one.
Yeah.
I mean, every pharmacist brings their own unique perspective, right?
Yeah.
Shaped by where they trained,
Yeah, it's like adding different ingredients to a recipe.
Absolutely. It
Yeah.
makes it more interesting.
Yeah, and Ireland can benefit from that
Right.
diversity of thought.
From having people who've
Trained all over.
from different systems.
Yeah.
Yeah.
So I imagine working in a different healthcare system.
Yeah.
You've been exposed to different
You've seen things differently.
medications, different ways of treating things,
Absolutely.
different, maybe even like cultural perspectives on health.
Yeah. You might have encountered
Yeah.
unique challenges.
Right.
You might have seen innovative solutions.
Yeah.
Different ways of approaching patient care
Yeah.
that we could learn from.
That could benefit the
Yeah.
Irish system.
Absolutely don't underestimate that global perspective.
It's like having a toolkit
Yeah.
full of different
Full of different tools.
tools.
Yeah.
From all over.
Exactly.
And so, yeah,
Like
Good.
embrace that.
embrace your background.
Yeah, leverage it.
Yeah.
It can make you a more adaptable pharmacist,
Mhm.
a more resourceful pharmacist,
Yeah.
a more culturally sensitive pharmacist,
Yeah.
ready to meet the diverse needs of patients here in Ireland.
That's such a good point.
Yeah.
It's not just about
It's not just about ticking boxes.
ticking the boxes.
It's about bringing your whole self
bringing something new
Yeah.
to the table.
and enriching the profession.
Exactly. And Irish pharmacy,
Yeah.
it's always changing.
It's constantly evolving.
So new people
We need those diverse voices.
so needed
Yeah,
to help it grow.
absolutely.
I think that's a perfect place to end.
I think so too.
We've explored what it takes to become a pharmacist in Ireland
We've delved deep.
with those non-EU qualifications.
In the knitting.
We've broken down the process,
Yeah.
the challenges, and the opportunities.
The whole journey.
So remember the PSI website.
Your
Yeah.
go-to
resource. Yeah.
Use it.
Use it wisely.
And don't let the challenges put you off.
Don't be scared.
With dedication and preparation
Yeah.
and a global perspective,
You can do it.
you can achieve that dream
Absolutely.
of practicing pharmacy in Ireland.
In Ireland.
Yeah.
We're excited for you
We are.
to embark on this journey.
Best of luck.
Best of luck.
And remember, the future of pharmacy in Ireland is brighter with diverse voices
Yeah.
and experiences.
Until next time, happy studying.
Happy studying.
And keep that dream alive.